Well, in three ways. The usual way with psychiatry is time, talking, and tablets. So whichever treatment we use, it's going to take a bit of time to do it. In terms of medication, obviously we can use benzodiazepines, which are drugs like diazepam, but anything with a PAM on the end is addictive, so these drugs shouldn't be taken for more than 4 or 6 weeks at a time, because you can get addicted to benzodiazepines, and it's very difficult to come off them eventually. So you have to come off them very slowly. So benzodiazepines, a group of drugs called beta blockers. Beta blockers block adrenaline, and they've come to fame with the professional snooker players and musicians who feel calm while they're taking them, because if you're potting a ball into the top pocket and your hand shakes and you miss cue, you miss the pocket. So what the beta blocker does, it blocks adrenaline and therefore relieves the anxiety, and therefore calms you down, so your hand doesn't shake, in other words. So beta blockers. Then there's another group of drugs which are antidepressants called selective serotonin reuptake inhibitors, SSRIs, usually drugs like citalopram or escitalopram, which take about 10 or 14 days to work. They're not addictive, and they relieve anxiety by working on the limbic system in the brain and the amygdaloid nucleus. And then there's a fourth group of drugs, a drug called pregabalin, which is actually an anti-epileptic agent, but we're not using it for epilepsy. It's a very good drug for generalized anxiety disorder, and it's usually given twice a day. It's a very rapid onset, so it doesn't wait 10 to 14 days like the antidepressants. It works virtually immediately. Very effective for relieving anxiety, and a lot of my patients find this drug highly effective. So we can either use a combination of beta blockers or SSRIs or pregabalin, or even if the anxiety is very severe, use all three. So that's the medication we can use. Regarding the talking treatment, anxiety management and relaxation therapy, because if you're relaxed, you can't be anxious. And if you're anxious, you can't be relaxed. So learning how to relax is going to make you feel nice and calm. Breathing exercises are very effective. So you just slow your breathing right down. So it's slow, rhythmical breathing. Because if you hyperventilate, you blow off the carbon dioxide on your lungs, and that causes respiratory acidosis, and so you hyperventilate even more. So that's why we use brown paper bags to breathe into, and they suck back their carbon dioxide and stops them from hyperventilating. So anxiety management, relaxation techniques, cognitive behavioral therapy, which is a treatment in its own right, of talking treatments, keeping mood charts, keeping ways of looking at things positively, so we look at the situation in a positive sort of way rather than a negative way. Getting rid of the ants, as we call it, the automatic negative thoughts or dysfunctional automatic thoughts. So getting rid of the ants and looking at things positively, developing a positive attitude about it, is highly effective for boosting confidence and self-esteem, and is also very good for anxiety. And there's a form of treatment called mindfulness, which is a type of transcendental meditation whereby you chant a special word, which is called a mantra, and slow your breathing down. So a combination of yoga and pranayama, which is deepening techniques in yoga, of slowing your breathing right down and calming yourself down so that you're feeling nice and relaxed and calm. All of these techniques are highly effective in relieving anxiety, but it's usually a combination of all three: time, talking, and tablets. And most people do very well with this approach and usually recover very well and then can stop the medication, but some people have to carry on with the drugs on an intermittent basis or a regular basis for the rest of their lives.